Hi, my name is Aliana Rushing. I'm with Senior Insurance Agency, and I'm here to do a quick FAQ about Medicare. So first off, what is Medicare? Medicare is a federally funded health insurance program that's offered to some with disabilities and people over age 65. Medicare has a few different parts. So the first part of Medicare is Part A. The second part is Part B. So those are known as Original Medicare. Part A is coverage for anything that is inpatient. So this can be hospitalization, skilled nursing care facility, some home health care services, and hospice care. Part B is coverage for anything outpatient. So this can be emergency room visits, doctor's visits, lab work, urgent care, x-rays, any type of imaging. So with Part A, most people do not have a monthly premium. With Part B, there is a monthly premium. For 2024, the monthly premium is $174.70. This premium can go up based on your income. Medicare Part C is the third part of Medicare. And with Medicare Part C, those are private insurance companies that are offering Medicare Advantage plans that are HMOs or PPOs. So this is similar to the structure of health insurance that you've had your entire life. You will have a doctor's network that you can go to. You will have costs out of pocket for care. Some Medicare Advantage plans do include additional benefits, such as dental insurance, vision insurance, gym memberships. Some have grocery benefits. Medicare Advantage plans are based on the county that you live in. So some counties don't have Advantage plans, some have many Advantage plans. This is where, depending on where you live, you need to shop your options. So Medicare Part C or Medicare Advantage plans is an alternative to having Medicare A and B. So when you sign up for Medicare Advantage plans, you are assigning that private health insurance company to be the manager of all your health insurance benefits. Medicare Part D is the fourth part of Medicare, and this is the prescription drug coverage. You can get prescription drug coverage through Medicare either by purchasing it as a standalone prescription drug coverage policy, or it can come combined with your Medicare Advantage plan so that your medical coverage and your prescription coverage are all combined into one plan. One last option with Medicare that many people opt for is a Medicare supplement plan, also known as a Medigap plan. With a Medicare supplement plan, this is a private insurance company that does not receive government funding. These plans are designed for you to purchase to be secondary to your Medicare Part A and Part B. So when you go this route and choose a supplement plan, you have your Medicare A and B paying out as your primary insurance provider, meaning it is their provider network, it is their cost for care, and then you are paying for a secondary insurance to help pick up the costs after Medicare pays. So if you have any co-insurance, co-pays, deductibles remaining, you can choose a Medigap plan that might cover some of those for you. The most common Medicare supplement plans is Medicare Supplement Plan G and Medicare Supplement Plan N. The Plan G will cover all costs after Medicare except the Medicare Part B deductible. When you're choosing to go on to Medicare A and B and adding a Medicare supplement plan with a standalone prescription drug plan, on average, depending on where you live, you might pay in total between $330 a month to around $400 a month for all the coverage combined. If you choose to go onto a Medicare Advantage plan, this is the lowest cost option per month, since with Medicare Advantage plans, there are typically no additional premiums besides what you pay for Medicare Part B. Now keep in mind with Medicare Advantage plans, you will have costs for medical care. So although you are lowering your monthly amount, you are potentially increasing your amount that you pay for medical care. To enroll in Medicare Part A or Part B, that has to be done through the Social Security Administration. So you have three options. Number one, you can make an online Social Security account. You can also walk into your Social Security office, or you can call the Social Security office and schedule an appointment to enroll in Medicare. When you have employer coverage, it is important to review your Medicare plan options and see if it's beneficial for you to go onto Medicare or to stay on your employer plan. The best way to figure this out is to work with a broker that can compare what you're paying for your employer coverage, what benefits you're getting, what medical care costs you, and what provider network you have. When you can compare that to your employer coverage to what's available to you with Medicare, that's going to help you make the best decision for yourself on whether you should remain on your employer plan or look into going onto Medicare. So your initial enrollment period to enroll into Medicare will start 3 months prior to your 65th birthday extends the month of your 65th birthday and up to 3 months after. That is the first time you will have an opportunity to enroll in Medicare Part A or Part B. If you choose to delay your Medicare, upon retirement, when you are losing your employer coverage, you do have a special election period, which is essentially a life event that will allow you to join Medicare at a later date past your 65th birthday. If your employer coverage is considered creditable to Medicare, then you will not face any late enrollment penalties for delaying your Medicare as long as you are on your employer plan. The best support line that you can have for Medicare resources is by contacting a knowledgeable broker that specializes in Medicare products. So while Medicare does have a line that you can call at 1-800-MEDICARE, or when you're enrolling in Medicare, you can work with the Social Security office for those first steps. Really, the best way to do it is work with a broker that can guide you through the process, help you enroll into Medicare Part A and Part B, help you compare your plan options, and that's right where we come in. So if you have any questions, please don't hesitate to give us a call. Check out our website. We have some good resources on our website also. Again, my name is Aliana Rushing. I'm with Senior Insurance Agency. If you want to give us a call and talk about your options, the number is 775-829-9600. Thank you.